What is one consumer tool that you're like, oh, we need that, where this is really going to improve or change or disrupt the way that we deliver care?
I am kind of a sports junkie, and I love how much data all these professional teams have about their players and how they're able to use that information to guide how they manage the team. I would love to see how we take the learnings from our professional sports colleagues and start to apply that to our pediatric patients that I think could really have a long-term impact.
That's fascinating. We'll have trading cards. I'll be like, I want a Sarah and a Natalie.
I love that, Sarah. That's so great. One of my favorite examples is the Apple Watch, which is only FDA approved for adults. And the algorithms are designed for adults. And yet we had some of our, again, teens for the most part, coming in to our cardiologist and saying, hey, remember how I kept telling you about these weird palpitations I was having? Look what my dad's Apple Watch or my Apple Watch showed.
I could be wrong, but I think Stanford adult has one of the largest Apple Watch trials in the country now with some 400,000 people.
Yeah, Stanford has been involved since the very beginning in validating some of the Apple Watch algorithms, again, in the adult space. And so kind of natural that we're looking at it in the pediatric space too, but still a lot of work to go.
Yeah, is there anything else that you wanted to say about this topic?
I love the sports analogy and the Apple Watch as well. So this weekend, I did a demo of the new Meta View glasses with a heads-up display.
Oh, you did? Wow.
And you guys, I'm telling you, there is something there that we need to marry with the EHR experience that's just completely going to disintermediate the way we're using our computers to get information that we need to take care of patients. This is way first gen, but we need to understand this.
Welcome to Beyond the Blueprint. My name is Greg Malkry from Spyglass Consulting, and today we're asking a simple question. What does it take to build a digital front door that feels seamless, safe, and secure, especially when parents are desperate for care? This episode is part of our collaboration with Ambient, the Association of Medical Directors of Information Systems. To help us unpack this, I've invited 3 national pediatric leaders to join me. We have Dr. Yaa Kumah-Crystal, Associate Professor of Biomedical Informatics and Pediatrics at Vanderbilt University. She focuses on real-time tech-enabled communications. We have Dr. Natalie Pageler, Division Chief of Clinical Informatics at Stanford Children's Hospital, where she leads pediatric informatics focused on complex care management. And we have Dr. Sarah Rush, the CMIO at Akron Children's Hospital, where she's focused on family-centered digital care programs. With that, why don't we go beyond the blueprint? Here's the harsh reality. A 2023 Pew survey found that 25% of U.S. parents struggle to access and understand their child's healthcare online. Hospitals have spent multiple years and millions of dollars building digital front doors and patient portals. For many families, though, these tools are difficult to use. Links don't work, messages go unanswered, and results confuse more than they clarify. Now, before we dive into today's discussion, I want to recognize our valued sponsors who've made Beyond the Blueprint possible, Simplify Medical. With their support, we're able to bring you insightful conversations around healthcare design and innovation. If you enjoyed today's show, I encourage you to subscribe so you never miss a future episode. Well, with that, why don't we get started? Yeah, I'm going to direct the first question to you. Can you share a story when a digital tool helped the family's experience for better or for worse? And what did your team learn from this experience?
One example I can think of that stands out in my mind quite often is I was on call, pediatric endocrinology on the inpatient side, and we were rounding on a patient, very complex medical situation. And by the time we got to the room to talk to the parents, mom was actually on her phone looking at the patient portal and was asking very pointed questions about some of the labs that had already come back. So she had a view of the information and was empowered to ask some questions about specific things and parameters and things like that that helped to steer the conversation. That could have gone one of two ways. Fortunately, I'd done all my pre-charting ahead of time and I was ready to ask about some of the questions she had for follow-up and give her my kind of early ideas for what the plan would be. But also, I could see how that could very easily throw off someone who expected the patient to have that knowledge ahead of time. And if the provider themselves hadn't had the time to review the lab and come up with some kind of plan, kind of having to think on your feet and think through what the implications of those labs are with the patients is just a very different dynamic than most people are used to. So I loved the way it empowered the patient to be able to think ahead of time. Even she had Googled some things. She had some questions for me. She was like, "What do you think about this therapy?" I was like, well, but at the same time, I think providers need to be more and more aware that this is just something that exists and that patients are able to do, and learn how to integrate that aspect in their care delivery plans.
Wow, that's a great point. I was just actually in the Stanford ED, spent 10 hours there, but I knew I was going to be there for a while. I came there with my sandwich and my podcast. And what I found, though, as the results were coming in my chart, I actually took a snapshot of them because there was so much blood work. I put it into ChatGPT, and I, in layman's terms, I put out what I thought I was presenting as, and it gave me back phenomenal information. I was really impressed. Maybe this is the next generation of Dr. Google.
Yeah, for sure. And Dr. GPT can present the information in a very articulate way, can summarize really well, can deep dive, can ask you follow-up questions for you to think about, but does not necessarily have all the context all the time. So there's a chance that the information that's presented back might sound really good, but might not have all the context to really bridge on what the plan would be. So I think it's important that patients are empowered and feel like they should be getting more information to understand what their care path is, but that as providers, that we can meet somewhere in the middle to understand, to explain like, okay, that I understand where you got that information from, but let me explain to you why, based on your specific presentation, based on the considerations about your child, we would approach it this particular way.
100%. The bias issue is actually huge. I had to dumb it down. I said, give me this in an 8th grade reading level, right? But that was enough, at least for me, to understand what exactly was going on. Hey, Natalie, let me pivot to you. What's one piece of feedback you've received from families about your hospital's digital tools that stuck with you? Something that might have changed how your team works?
I'm going to tie it back to a long body of work that we've been doing at Stanford Children's, and kind of adds to some of the complexities around for this topic in pediatrics in particular. So the example I'll give that was feedback of a sort was unfortunately around one of our adolescents who was seen at our organization on our teen health van. And it was supposed to be a confidential encounter on our teen health van. And we got a call from mom saying, "Why is my daughter being seen on the teen health van?" And so it was clearly a situation where mom got information through our electronic health record that she was not intended to get. And that has spawned an entire body of work that the teams at Stanford Children's have been focusing on, and on our academic teams within our Department of Pediatrics and Division of Clinical Informatics have been focusing on to really address these challenges in pediatrics, where our goal is to fully engage the child, the teen, and their family as much as possible. And yet there are some complexities where there are these teeny tiny use cases that are very significant and important, where we need to be able to confidentially engage with a teenager to provide the best care possible. And so trying to separate this out, especially digitally, becomes challenging.
Sarah, I want to get you into the equation here. Have you seen a time when technology has helped families feel more connected or made their experiences more difficult?
Yeah, absolutely. I think the connectedness has really come as we've thought about how we connect differently. We've really looked at how do we build opportunities both digitally as well as the kind of traditional mechanisms for connection, and how do we deploy those across a number of different populations. So for example, we all really think about what it means to go to the doctor, and it means showing up in person and having an appointment. But what we wanted to do was turn that on its head to a certain extent. And, some of the situations of the past years early in the 2020s have forced us to, but I think what we really thought about is how do we maintain that? How do we think about telehealth, for example, as the solution to deliver care in a way that we probably didn't before, and for groups that maybe not have thought of it as a way before, because I don't know that we always think about how much of a burden it is for families to try to come to the doctor. I mean, they have to take off work, and a lot of times kids miss school. It's not cheap. And I know I live in a place where cost of living isn't what it is in other places, so I can only imagine what that is for a lot of families. So providing and developing digital tools that enable us to deliver care where that patient is or where that family is and when they need it, I think is one of the things that we've really tried to focus in on and do better with.
I did notice, Sarah, that you're focused on a lot of the virtual care programs. Are you noticing any difference? Because during COVID, there was a huge spike in the use of virtual technologies. Are you noticing anything now post-COVID where has it decreased or has it stayed relatively the same?
We've actually seen a growth in our programs. I think a lot of that comes from the fact that we've really focused on the seamless process of it and making sure that we're leveraging areas where it makes the most sense. For example, we have a virtual quick care. So patients can really just get in anytime and have a visit with one of our primary care advanced practice providers for whatever the situation may be. It's cut down on our urgent care and ED visits, but also enabled those patients, again, to get that care where they need it, when they want it. I think more importantly, because their hours are different than what we see in our primary care. So because our specialists are starting to think differently, we're trying to extend our services to areas where historically pediatric specialists are not available. So if we can leverage the technology to put our pediatric specialists out into places where it's even harder for patients to access, I think that's really where we've leaned in and seen a lot of successes.
I'm a big fan of virtual care, and as long as it's with a doctor I already have a relationship with. I'm not as keen on the third party doc that I don't know. Let's transition. Let's talk things about how hospitals are breaking through trust barriers using digital tools to keep families more informed and connected. Natalie, I'm going to go back to you here. Which digital tools have you deployed have had the greatest impact in making care easier for families? This could be things like real-time updates, multilingual messaging, wayfinding. What do you guys do? I know you guys are on the leading edge, but what is top of mind for you?
Yeah, great questions. I think one of the nice things is we've got such a wonderful national pediatric informatics community. So we're all sharing and learning together. And so I think you'll see a lot of commonalities. Again, I think part of what we're really trying to do at Stanford Children's and more broadly is be able to reach our patients and families when and where they need us. And again, it's so much more complex when you're talking about pediatrics and trying to make sure you are reaching the right people and all the people that are engaged in care. And so the portal itself has been a huge advance and a huge amount of work to get it right. So I can go on forever talking about the multiple different steps we've been doing to try to get that right, but really making sure that we are both reaching all the parents or other guardians that are involved in care and getting them portal access and knowing what their appropriate contact information is. And then also, as the child grows and becomes a teen and starts taking on more and more autonomy, getting them access and communicating directly with them so that by the time they are 18, they have also learned how to manage their own healthcare and can safely transition into an adult. And so done a ton of work around reaching people, contacting the right person, getting the right information to the right people. And usually that's as much information as we can possibly get to all the family members. So that's been a major focus. And then to Sarah's point, that also enables things like telehealth, for example. And so you have to, if you want to be able to reach set up a telehealth visit with a teen while they're at school with their school nurse, you have to have that portal connection with them. Or if you want to be able to include mom and dad and grandma, you have to be able to have those portal connections with them or have the ability to reach them wherever they are so you can include them in those conversations. So that's been another major advance. And then the other thing I was thinking, especially as Sarah was talking and again, emphasizing everything she said about pediatrics in particular, children's hospitals are few and far between, mostly because children are relatively healthy and we don't need as many subspecialists as you do in adult care. But that means our patients and families have to travel such far distances to get care. And it's a huge imposition, missed school and missed work for the adults that take them. So anything we can do to digitally reach them really decreases the burden of healthcare. And so again, that telehealth is huge. The other thing that we found though is our e-consults workflow. And that gets to both that digital remote access, but also, Greg, to your point about you're engaging with somebody you know. So you may be engaging with your primary care physician wherever they are locally, and yet that primary care physician is getting the expertise from that subspecialist who may be miles away. And so that has been a hugely helpful workflow for us.
I didn't really realize the complexity, as you just brought it up, about how the needs change as the child grows and their ability to advocate for themselves and the different changing. That's pretty complex. I did notice that you raised your hand, Yaa. Did you want to, or it's just the AI tools that we have here?
No, I wanted to kind of paddle off of what Natalie was saying and react to a comment that you made earlier. It was something along the lines that you enjoy telehealth with a provider but not necessarily one of the virtual providers that just pop up here and there. In a pediatric context, actually, there was a recent publication that came out about what patients are looking for in virtual or chat-assisted tools. And there's a cohort that the anonymity of having a virtual doc or someone they don't know when it comes to things like STI counseling or contraception counseling or other things that they consider more private or personal or wouldn't necessarily want to have a conversation with someone who they've known for a very long time with. So I think there's an interesting dynamic in pediatrics, and honestly, adults as well, where having the ability to have these interactions with someone who you don't have this kind of long-term relationship with is still important, but still being able to somehow have that information fed into kind of your medical chart, medical home. And that's a dynamic I don't know that we figured out how to completely solve yet. But the concept of being able to have this one-off conversation that you might be too kind of embarrassed or whatever to have with your regular is an interesting thing that I think technology may be one of the things that can help us solve over time. And then the concept of missed school with our kids particular. So I'm an endocrinologist. I see my patients with diabetes every 3 months just to adjust their medications. They grow so fast, you get their dose right. And then in 3 months, you have to adjust everything again. But retention and school missing is a huge deal, certainly for Davidson County here where I live, but I imagine all across. And truancy. I had a patient come to me and the mom was like, because of the clinic visits he has to have, he actually is missing out on all these like incentive parties that they give at school for kids who have had attendance. I'm like, well, but it's for medical excuse. They're like, yeah, they don't even count that. It's only if you've had perfect attendance. I'm like, well, that just feels a little unfair because he's being penalized for something that is out of his control and he's required to come to these visits. I would have to call DCS on them if they didn't come to these visits. So I actually used ChatGPT to write a letter to the principal explaining the importance of him coming to a clinic visit. And what I loved about the letter, because I just said, help me write a letter explaining the importance of these clinic visits. ChatGPT took the initiative to include elements of according to American Diabetes Association and the American Disability Association regulations, so on and so forth. This is, disadvantaging the students. So, and I'm like, this is I in some universe, I probably could have come up with all that myself. But I just love that these tools helped me come up with something that could just very well articulate just general facts and statistics
and in 10 seconds.
It was amazing.
Wow, that's awesome. I want to check in with Sarah. Sarah, let's expand the conversation. How have you seen digital tools help reduce anxiety or confusion for families in order to address barriers like language, literacy, or device access?
Well, I think going back to what Yaa was talking about, it's given the opportunity for them to have more access to things. Again, I think the providers, the clinicians at my hospital are getting a little tired of being like, why do we do it that way? Why do you do that? Why do we have to? And really turning healthcare delivery on its head to think about how we could do it differently with the patient truly at the center. I think we talk a lot about patient-centered care, but in the end, I really have to push back on that and say, I'm not certain we're there yet. And so I think how we develop tools that empower patients to have the information they need, the access they need in a way that they want to consume it. Because again, to Yaa's point earlier, our patients are younger and younger, our parents are younger and younger, and they have grown up in a different system of how they get information from social media, how they consume news, how they consume any content. And I don't know that in healthcare, we've really truly stepped back and understood how we translate that into how we deliver care. So some of the things we're looking at are implementing some of those types of solutions to meet patients where they are and provide those sorts of resources, be it information to consume and allow them to text message or to asynchronously send messages through the portal that connect with the right person. Maybe it's not the provider, maybe it's somebody else, maybe it's no one they know that they want to connect with, but really stepping back to think about how we're doing things in a way that meets the needs and the preferences of the patients and families that we serve.
Wow, you bring up a great point. Now, I know in Palo Alto, we're most likely to have very highly educated folks with high disposable income, comfortable with technology. But how do we address on a national level the change management issues with staff, with patients and family members? Is everybody ready to embrace this? I might be in Bakersfield, California, right? I'm an undocumented worker.
Yeah, I think that's
how do I
part of
address these issues?
I think that's part of the challenge we try to understand, and I'm not even going to begin to say that we do it well. I think we're just more than anything trying to understand it. Standing up areas where people can go. We created a space in one of our locations that's remote from the hospital where there's a private space that patients can go and connect. There's Wi-Fi there. There's a booth there for them to go and connect, readily accessible in other ways through the brick and mortar that we have. But I think also trying to be creative in how we ensure that. And, digitally, I think sometimes that's hard, but also, I think maybe sometimes it's not as hard as we make it out to sound. And so I think just trying to be flexible with that. I don't know if Natalie or y'all have thoughts on that.
Yeah, happy to jump into. I mean, this is an incredibly I think it is a complex problem. I think there are ways that we can make it simpler and that we need to make it simpler, but it's something that's really important to think about. And I would say, yes, we have some well-informed and very digitally savvy patients and families in Palo Alto. And yet this is a huge issue for us and for so many of our patients and families for many different reasons. And so just a couple examples on that point. One, again, the extra complexity in pediatrics has made it really challenging. And so we, again, have been doing this work for 15 years or so, trying to figure out how to digitally engage our patients and families and really use the portal to its fullest extent to support children and families, and found that while we are trying to create teen portals in addition to the guardian portals, we want both. We want everybody to be informed and engaged, but we're trying to create teen portals so that we can help our teens to mature and start learning to take care of their healthcare. Even though we've been doing that work for a very long time, more than 50% of those supposed teen portals were being used by the parents or the guardians instead of the teen, even though the parent and guardian should have had their own portal access. And what turned out was happening was both our teens, our parents, and our staff were all confused about how it was even supposed to get set up in the first place. And some of that goes back to some very basic structure in the EHR. I know Yaa and I think Sarah has both heard me say this, but it turns out that babies, even in Palo Alto, aren't born with cell phones. And yet the first thing that we do when we register in the EHR is we put in first name, last name, email address, cell phone number. And of course, you put in whoever might be standing there. So you don't know whether that phone number and that email address is mom, dad, grandma, and you don't know what language they speak. And that carries through. And then their portal, when they're a teenager, gets set up with that wrong information. And then sometimes when they're a young adult, we get the lab calling mom about an STD result because it's all set up wrong. You laugh. This happened even despite all our work, happened accidentally a few months ago. And thankfully, it was a very understanding OBGYN mom, but got her 22-year-old son's results. And she's like, hey, what's going on? And this is despite all of our work. And so it just really highlights how important it is to make it clear how we log information about children and families, how we separate the information about the child, the patient versus their guardians, how we reach out and contact the right people, and then how we make it really easy for people to understand who's supposed to be doing what. So similarly, along with this work, we were looking at some of our Spanish-speaking patients and families and their portal access, and found that they, despite having a Spanish version of our portal, despite having interpreters available on all of our helplines, despite having all of our materials in Spanish, our activation rates for our Spanish-speaking patients were much, much lower. And Naimisha Chillicurry and Aaron Ballard in our organization led a 2-year project to try to really simplify the user interface, to evaluate all the different barriers to accessing and setting up the portal. And we're able to make a significant difference. But it took a ton of work. And so it just really speaks to how much work it takes to make things as simple and clear as possible and to make sure we're addressing all of those barriers to engagement.
That is a great point. And yeah, I want to get you in the equation here. Where do you still see families falling through the cracks or with patients falling through that? And how are you reaching out to these patients? Because, as Natalie just pointed out, the Spanish-speaking patients are not having as much receptivity to the tools, but there could be many other different demographics as well. So what are you guys doing at Vanderbilt?
Agree that the language barriers sometimes pose the most challenging aspects of being able to get patients engaged. And there are several kind of dimensions and kind of like holes in the whole Swiss cheese model. Unfortunately, time-wise, some providers, you have a 20-minute slot, whether the patient is English speaking or Spanish speaking. By virtue of the fact that you're using an interpreter, the meeting's going to take twice, if not 3 times longer, because you're speaking to them, it gets interpreted, then interpreted back to you. So it's going to take a longer time. So just dynamics alone, it's probably more challenging for those providers to figure out how to onboard the patients and get them all the information they need in that same amount of time as they would with someone who's not. So barrier number 1. Barrier number 2, having patients have all the right resources and tools that they'll need to be able to efficiently get set up on the pediatric side of things. And it's challenging because it has to be challenging, I suppose, but it's not just about getting them access to the portal, but depending on the age of the patient, if they're that, teenage window where everything becomes impossible, not only does the patient have to provide assent, the parent has to provide consent also, and there's like signing off, and there's even paper involved in the process where like certain areas and certain states require that there has to be a wet signature for someone to sign off to say that this is going to be allowed because of that special window adolescence where information sharing becomes a lot more complicated. So there's that layer of things as well. And then when the information gets over, how easy is it for the person to interpret? My oldest son is 14 years old. I would love for him to have a patient portal account. I know for a fact he'll spend more time on Roblox than he will ever spend on his version of the patient portal account. So how accessible that information, how relevant, poignant, pertinent is that information to them? So there are lots of levels to address to make sure that the patients, our pediatric patients that we're raising to be adults, we, the whole family and us, the pediatricians, we want these young children to grow up to be competent adults. And I think part of it is having some of these conversations like in the visit and explaining not just to the parent what their illness is, but also to the child, like what is it you understand about what's going on right now? What questions do you have? And helping them feel empowered to ask them the right questions so that along the way, they can have those interfaces. And leveraging some of these new tools, like maybe they don't understand what this means, but a lot of them are using ChatGPT for their homework now. So maybe they can use it to ask questions about their lab tests as well. That's HIPAA compliant.
Our docs, especially older docs, are they ready for the empowered patient, empowered family member?
Ready or not, here it comes. I think there are definitely different people who had different workflows. COVID, I think, was kind of the best testament to when the going gets tough, tough gets going, and kind of do what you have to do. Because even the folks that, were not considering themselves technologically savvy wanted to make sure the patients got the best care and wanted to make sure the patients were still connected during that time. And they would spend extra time with medical students who were teaching them how to use Zoom or Teams at the time, and they just did what they had to do. And I think now that there's more of an understanding that, like it or not, Dr. Google is now Dr. GPT, people are trying to become more informed and educated so that they can explain back to the patients how to find the right kind of information.
Awesome. Sarah, let me ask you a tangential question just about technology and how do we make it feel more human, right? Looking at chatbots, messaging, clinical updates. Are we figuring out how to really connect on a human level with patients using digital technology?
I think one of the coolest stories we've had lately is the Ambient Scribes that we've implemented and, how that technology has really, more than anything we've done, fostered that connection back between our providers and our patients. So the provider comes in and presses record and the whole conversation now focuses back on providers looking at patients and connecting with them instead of sitting behind the computer or making sure to document all those things. They stop the recording, create the note, and it's not only improved the connection between the patients, but it's also decreased that cognitive load for our providers so that they really feel like they can truly focus. And it's been amazing to hear some of the stories of providers and what they've said this has done for them. I have a neurosurgeon who came to me and said, I don't hate clinic anymore and I don't want to leave medicine. And when a neurosurgeon tells you that, like, that's kind of a big deal. And so I think that's really one of the tools I've seen that has made the biggest impact on both our providers, clinicians, and patients as well.
How do we measure the success of these tools, right? Are we looking at clicks and logins? Are we looking at outcomes? How do we know the tools that we're actually putting into place are actually working? I know that's maybe that's very subjective.
Well, in that particular situation, I think we're looking at all of those things. We're looking at the clicks. And I think what was interesting for us as we started to measure this, is that it doesn't actually save time. So there's a margin of time that's saved, but it's truly more about the impact that the conversation is having. We're not far enough along in our journey to really, I think, say that we can measure true patient outcomes related to the technology, but I can sure tell you anecdotally and by measure of how our providers are reporting burnout, we're having an impact on the provider side, and it's very clear. I think that's one thing we've been able to measure without a doubt is the impact that it's having on our providers. So again, I would say harder to state that we're having an outcome impact for patients, but we are for sure for our
Well, how do you
providers.
measure the impact from patients or family members? Do you have a full inbox of messages from patients on what they like and don't like? And, as a result of the tools you deployed, Natalie, it made my experience X, Y, and Z. And how do you translate that into updates in the tools you're going to put out next?
Yeah, it's a great question. And, we get some unsolicited responses usually when something goes wrong. And so definitely hear that and get feedback on how we should do something right. And we do get some, positive responses. And I think it takes some really focused attention to get most of the feedback. So for example, early on in our open notes endeavors, even before the 21st Century Cures Act final rule, we were sharing notes with our guardians and did a feedback form with that for people that were receiving those notes, and got incredible feedback talking about how this had changed their ability to manage their child. So, there's this quote that I often cite from one particularly grateful parent talking about how she had a child with a very complex illness, and she, was often the one explaining it to other providers. And so having access to all of her notes allowed her to make sure that each provider had all the information about him. And she could also share it with his teachers or his other babysitters or other caregivers. And so really helped us understand how powerful that was and how important that was, despite some of the challenges in sharing notes with children and families. And that really pushed that work forward. Similarly, right now, we've heard anecdotal responses to some of our ambient scribe technology, things like parents coming out of the room and like, my provider looked at me the whole time and actually talked to me and wasn't working on their computer the whole visit and felt really engaged. And so now we're doing a formal evaluation. And Bethel Mieso, who is one of our second-year pediatric clinical informatics fellows, has an entire study right now where she is going into clinic and doing surveys with all of our children, patients and families about their experience, and then doing some long form interviews with them to really understand, is that the typical response? Are they feeling more engagement, or are they feeling a little put off that there's a recording device in the room, or what do they feel about AI being involved? So I think there's some really complex potential reactions, and it's going to continue to evolve. I think to Sarah's point, we are very early in this journey. And so there's a lot of work we need to do to understand how these technologies are impacting our patients and families.
Excellent point. While I have 1,000,001 questions I'd love to ask you, I want to shift now to our peer challenge question. Yeah, I want you to ask one bold question to Natalie and Sarah, a question that every healthcare leader should be asking about digital family engagement.
All right. So get ready, guys. And because I gave this some thought and I actually have an idea of my own. So I want to hear what you guys say. What is one consumer tool in the consumer realm or something you've seen done reasonably well or that is emerging outside of medicine that you're like, oh, we need that. This is really going to improve or change or disrupt the way that we deliver care?
I don't know that it's got a specific name, but I am kind of a sports junkie, and I love how much data all these professional teams have about their patients or about their players, and how they're able to use that information to guide how they manage the team. be it from who plays to how they manage the health, how they manage diets, based on all this information. So I would love to see how we take the learnings from our professional sports colleagues and start to apply that to our pediatric patients. Imagine what it could do from, let's say, a concussion perspective. If we understood what the NFL understands about concussions and started to implement things like that in elementary school, what could those different outcomes be for those patients? So really thinking about those things that they use and how they manage and applying those sorts of data techniques to our patients, I think could really have a long-term impact.
That's fascinating. We'll have trading cards. I'll be like, I want a Sarah and a Natalie.
I love that, Sarah. That's so great. Well, one, I would just to add on, we've already mentioned large language models, which I think are changing this scene so broadly and like giving people the ability to kind of ask them their own questions and have a bit of a conversation before they come in to talk with us. And I think, again, especially in pediatrics, there's so many devices out there where we are getting data in our daily lives. And there's this question of how does that apply in pediatrics? So one of my favorite examples is the Apple Watch, which is only FDA approved for adults. And the algorithms are designed for adults. And yet we had some of our, again, teens for the most part, coming in to our cardiologist and saying, hey, remember how I kept telling you about these weird palpitations I was having? Look what my dad's Apple Watch or my Apple Watch showed. And so Scott Sarasnik, who's one of our cardiologists, and then Aydin Zahedovic, who's one of our, again, pediatric clinical informatics fellows, decided to launch a pediatric Apple Watch study looking at exactly that. How reliable is it in kids? And it's fascinating because some of our kids who have some weird arrhythmia, it wasn't getting picked up on their Zeo patch. It wasn't getting picked up on the EKGs when they're in clinic. And yet if they wore the Apple Watch long enough, suddenly they'd get a recording that they could use to really figure out what was going on.
Wow.
And so I think it just speaks to this need. There's so much that's developed for the adult space, and there's development that needs to happen specifically in the pediatric space. And there's also this need to test some of the things that were developed for adults. Maybe they have applications in peds. And we just need to figure out what those are.
I could be wrong, but I think Stanford Adult has one of the largest Apple Watch trials in the country now with some 400,000 people.
Yeah, Stanford has been involved since the very beginning and validating some of the Apple Watch algorithms, again, in the adult space. And so kind of natural that we're looking at it in the pediatric space too, but still a lot of work to go.
Yeah, is there anything else you wanted to say about this topic?
I love the sports analogy and the Apple Watch as well. Pediatrics often seems to be an afterthought when it comes to research. And I think for good reason, they want to make sure it's safe in adults first before things roll out to peds. But I agree that we definitely need a lot more bravery and boldness when it comes to evaluating things in peds. So this weekend, I did a demo of the new Meta View glasses with a heads-up display.
Oh, you did? Wow.
And you guys, I'm telling you, there's something there. I don't know that this is the final form. Been interested in this space since like Google Glass back in the day. I have one that's like sitting here gathering dust, but there is something super interesting about this form factor. One that looks normal, like regular glasses, has the heads up display so you can see the words on the screen and has a smart assistant built in. And it has like live translation. So like as the person was talking, you could see what they're saying like on the screen. And when you ask questions, it shows like an image and all that stuff. There is something there that we need to marry with the EHR experience that's just completely going to disintermediate the way we're using our computers to get information that we need to take care of patients. So I am digging more into this, and I think there's something interesting there. Again, I don't know if this is the final version of what we're going to have. This is way first gen, but we need to understand this.
Outstanding. Guys, I'd like to thank you for your insights and perspective. This has been really exciting. Before we wrap up, though, for our audience members, we have 3 quick takeaways for pediatric hospital leaders. First, make access effortless. Every patient or every parent should be able to reach care easily, no matter their language, literacy, or device. Second, blend empathy with efficacy. Technology should help people, not replace them. And third, measure what matters. Track trust, relief, and connection, not just clicks and logins. So when families feel connected, digital health actually works. It helps families get answers faster, worry less, and focus on their child instead of the technology. Thank you for listening to Beyond the Blueprint. This is Greg Malker, and I look forward to seeing you next time. Thank you. Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.